Afternoon, and you're very welcome to this UCD Masters Week 2025. Excuse my voice, I'm quite hoarse from a cold, but we'll keep going. And for the first session today, we're looking at the Master of Public Health Programs. So my name is Professor Patricia Fitzpatrick, and I'll be joined today by my colleague, Associate Professor Mary Codd, who will be talking to you about the MPH degree programs. She's the Programme Director of the MPH. And we will also be talking to Sonal Subash Mohite, who is a graduate of our MPH program. And we're very happy that she's been able to join us today to give her experience of the program firsthand. I might just mention to you that this is being recorded, and also to mention to you that there is a Q&A button, and please put your questions in through the Q&A as we go through the session, and we will try to address them all at the end. So, University College Dublin is one of Europe's most research-intense universities, and it's in the top 1% of universities worldwide. It has 38,000 approximate students from 144 countries, so it really is an international university. And we welcome international students very much. We have a whole section devoted to our global kind of, outlook for students. UCD is a leader in graduate education itself, which of course is part of graduate education. And we currently have about 12,000 graduate students. We're located about 6 kilometres from Dublin city centre, but we're on a lot of bus routes, and it's very easy to get to UCD from a lot of places around Dublin. We offer state-of-the-art facilities educationally, but also you can see here some of our lovely sporting facilities that we have, the fantastic running track, the lovely 50-metre pool, and there are sports clubs and societies facilitating all types of student interests. And there's free access to the gyms for students and free access to lots of fitness classes every week. So it really, you, as part of your academic life in UCD, you'll have an opportunity to pursue other interests as well. Next slide, please. So the School of Public Health, Physiotherapy and Sports Science is located in the College of Health and Agricultural Sciences. And we run programs across public health, occupational safety and health dietetics, food safety, physiotherapy and sports performance. But today we're talking, or at least now we're talking about the MPH programs located in the public health section of this school. And the faculty in public health has international reputations in areas of practice and also of research. Our lectures and our seminars are held in state-of-the-art facilities, some of which you can see here in the pictures, in very, very modern buildings across the campus. So that's a quick summary of UCD and our school, just a quick intro. You'll see lots more on our website if you go and have a look at our website. But for now, I'm going to pass over to my colleague, Associate Professor Mary Codd, the Director of the MPH programs. Thank you, Mary.
Well, thank you, Patricia, and good afternoon, everyone, from wherever you're joining. So our public health program at UCD has a very long history. In fact, started in 1905, 120 years ago, as a diploma. It evolved into a master's program 42 years ago in 1983. And since then, it has evolved in keeping with developments in society, political impacts, and so on. And it is really at this stage, like public health programs really all around the world, has become increasingly diverse and really is an all-encompassing specialty. As you well know, public health was at the forefront of the national and international responses to COVID-19. And as a consequence, it's been propelled into a different space with huge developments in public health education. And there are really important things like addressing the digital transformation in public health, looking at infodemiology and the impact of mis and disinformation on public health policies and strategy. We can't ignore the existential threat that is climate change in our world at this time. We concentrate in this university to some extent on One Health, having the confluence of health sciences, veterinary medicine, and also agriculture and food sciences. We're very fortunate in that regard. Other interdisciplinary professional skills that we promote within our program include evidence synthesis, communication, advocacy, and I should mention leadership too. Next slide, please. So we run different programs within the Masters of Public Health program. We call them streams. We have a general MPH, possible to do this part-time or full-time. We have an MPH in epidemiology, in global health, in nutrition, and we also run year one of the European Master of Public Health program. All of the programs are 90 credits, with the exception of the EPH, which is actually 120 credits, of which students do 60 in year one here in this university. For all of the MPH programs, there are 60 taught credits. We follow the ECTS system. They're comprised of both core and optional modules. We still run mostly a face-to-face program with some blended classes. But we're very keen on the interaction that we have with our students and very proud of that. As I mentioned, it's possible to do these programs full-time in 1 year or part-time over 2 years, apart from the European Public Health Master program. Next slide, please. This is a little complicated. What it shows are the modules that we run in both autumn and spring, and there are some more spring modules on the next slide. They just wouldn't all fit on one slide. But the core modules for virtually all of the streams are really quite common. Principles of epidemiology, biostatistics, research methods, communicable and non-communicable diseases, and introduction to systematic reviews and meta-analysis. Those all take place in the first trimester. In spring trimester, there are also some core modules, but because different streams have different cores, you're beginning to see some optional ones listed there. Public health policy and practice is a really important module, which we make core for our MPH General and MPH Global Health. Health promotion is core across virtually all of them, and health economic analysis likewise. Next slide, please. We also have global public health as a core module in all of our streams. And then you can see the others listed here with varying degrees of whether they're core or optional. We like to have the possibility of students to take optional modules, at least one, perhaps two, and you can see in parentheses there in red the number of core modules, core credits that are taken in each program, and the flexibility that that gives to students to take some others that they might have a particular interest in. So Biostats 2, clinical trials, One Health, nutritional, genetic epi, a second more advanced systematic review meta-analysis module, and a graduate teaching assistant module, which we put in place some years ago and which is quite popular. And students like to, as it were, cut their teeth on some experience in teaching under close monitoring and help from faculty. Then for each of the MPH streams, there's a dissertation, which is 30 ECTS. Next slide, please. In terms of the dissertation, this is something that sometimes causes people quite a lot of anxiety. We run a very structured process for our dissertations. There are two options in terms of conducting either a data analysis project or carrying out a systematic review or meta-analysis. We have several sources of secondary data that we use. We typically do not collect primary data simply because there isn't time within a one-year program. Getting ethical approval alone could take half the year. So we tap into existing sources of data. Here I've shown you national sources, the Irish Social Sciences Data Archive, for example, Health Information and Quality Authority data, and some others that are listed there, including NCRI, National Cancer Registry, and Health Protection Surveillance Centre of our Health Services Executive. We also have the potential for students, for supervisors, to provide data from their own research activities for students to analyze. The format of the thesis is what you might say is more traditional format, but recently been redeveloped to the structure of a scientific publication. We're very pleased with the fact and very proud of the fact that students very frequently can submit the abstract of their thesis directly to scientific meetings and have been successful in having presentations at those meetings. Next slide, please. Our faculty is strongly linked internationally on various things, especially on teaching, curriculum development, of course, scientific research and validation. And Europub Health is the Erasmus Mundus joint master degree program that we're linked into with 7 other universities across Europe. We have very strong links with ASFER, which is the Association of Schools of Public Health in the European region. And we have been at the forefront of developing the ASFER core curriculum for public health. We also have very strong links with EUFA, that's the European Public Health Association. In fact, I've just come back from this year's EUFA meeting where we had tremendous presentations from our group. We're linked in with the Universitas 21 Health Sciences Group, with AFIA, which is the Agency for Public Health Education Accreditation, and with ECDC, which from the point of view of setting standards, developing competency frameworks, and potentially providing opportunities for graduates to partake in their training programs, in particular their EPIET program. This is really an important link for us. That's the European Centre for Disease Prevention and Control. Next slide, please. Our faculty, as Patricia mentioned, is quite diverse. This is not the faculty, this is this year's student group, but we do have people from in different places around the world, and we have people who have been internationally trained, even if they have originated from this country. We also invite guest speakers, particularly from our public health colleagues within the Faculty of Public Health Medicine at the College of Physicians, and also from our colleagues within the service, the Public Health Service of the Health Services Executive. We have approximately 60 students per year. This year it's actually 65. Here they are. This is a recent symposium they attended, run by the Irish Global Health Network. And we love to be able to facilitate their participation in 1 or 2 of these types of activities during the year. 70 to 75% of our class come from non-EU countries. This year we have 20 countries represented within the class, and we really foster and pay close attention to intercultural exchanges and collaboration across boundaries. We believe that this is an important aspect and component of being able to facilitate having a very international class. I should also say that people come from many different backgrounds, mostly, of course, within the health sciences, but health sciences right across the board. And also we have people from the humanities from time to time, from economics, sociology, psychology, and even history. Next slide, please. So Jenny has added here how to apply for the program. There are criteria given there. Primary among them are the level of degree in previous award, the evidence of the highest level of mathematics achieved in prior education, and demonstration of proficiency in English to a required level. I would just say that in relation to the mathematics, prior education can be secondary or high school education or previous college, not so much degrees as modules or courses in mathematics or in statistics. And this is because it is really a highly quantitative program, and we don't wish for people to feel stressed by not having an adequate background in quantitation. And the applications include an up-to-date CV. You'll see a little more detail on the website. We prefer the Europass format, personal statement, copies of academic transcripts, official academic transcripts, and references. Next slide, please. So very happy now to take any questions that you might have. Oh, first we've got Sonal, who's going to I think, give us an insight into why she chose to come to UCD and what her experience was. Thank you.
Thank you, Mary. Thank you very much for that. So now turning to you. Um, Thank you very much, first of all, for joining us today. Can I first ask you why you chose the MPH in UCD and what stream did you take?
Okay, thank you for the warm welcome, Professor Mary and Patricia. For me, the reason I chose public health is because I come from India, and in India, public health is quite famous in dentistry. We have a final year module of public health dentistry where we learn about epidemiology of dental caries and different instruments and different types of cases, studies. So public health really inspired me. I wanted to learn more beyond the clinical work and be able to apply knowledge to a broader audience.
So
UCD,
why UCD?
yes.
Yeah.
UCD, I think, offers a really balanced core module program. And we, before choosing UCD, I had looked toward all the modules that was offered, and I saw a perfect balance between clinical and applied knowledge and practical skills there. And yeah, coming to UCD, learning through all the modules, I think I'm really satisfied with all the work that I've done because it really touches down to all the areas you expect to touch down in public health.
That's great. And what stream did you take? What was the stream you took?
For me, I had chosen MPH General. So I had all the core modules that we have listed for the MPH core journal.
So what was your favorite part of the course
I think it's really hard to choose. But I think the favorite part was interactive learning because we had a really diverse population in the batch. We had people representing from 29 countries. And the group activities that we had among different modules, I think it really helped us to learn through each other, to get our head around different concepts of public policy and case studies, analyzing cases and analyzing articles and the research methods. So I think learning with everyone, learning different intercultural things, and it was really inspiring how we could together work as a team because I think that's really important when you step outside of the master's program. That is something as an international student, at least having that kind of background, that kind of exploration is really required. So,
Yes, and it prepares you for the workplace as well, the teamwork
yes,
we kind of
yes.
build up during the course. So did you find any part of the course challenging?
I think it was towards the end of the semester. I think it's just normal for every student to experience some challenges. It was not a lot, but a little challenging with the overlapping assignments towards the end.
Yeah.
But I think it's something that you go through. It's not really challenging.
Yeah.
It helps you
Yeah.
manage your time better. So
Yes. Well, it prepares you for competing priorities in the workplace,
yes, that's
yeah.
right. Yes.
But yeah, it is always end of trimester is always a difficult time for students, always. And what was your schedule like each week? Give a flavor maybe for the students, what kind of days you were in, that type of thing.
For the schedule, I think the first trimester that we had was we had our lectures from because I was in the core. We had core modules throughout the week. So
And were they
on in
on,
the
were they
first,
mostly Tuesday, Wednesday, Thursday, I think probably, were they?
yeah, the mostly Monday, Tuesday, Wednesday, and I think some part on Thursday. We mostly had optional on the Fridays. But they were planned out quite well because we had enough time for after in between the lectures. We had enough time for if we are doing any group studies.
Yeah.
And I think in the in the spring trimester, it was really well laid out. It was just Monday and Tuesday, Wednesday, and the core modules. And if we had any optional, then they had different schedules.
Yeah, of course, yes. And what are you doing now that the course has finished and you've graduated?
Yes. So I was lucky to land up a volunteer internship in One Health Center. I got to know about UCD One Health Center through one of the guest lectures we had in public health policy in our spring trimester. Through that, I reached out to the One Health Center director, and I told them about my interest in One Health, and I volunteered for some time, and now I'm working as a full-time employee there.
Very good. That's great. Yeah. So, once you get in, then you can progress and they see how valuable you are to them. It's
Yes.
fantastic to see that.
Yes.
And uh, what about the UC campus? Did you get a chance to enjoy the campus?
Oh yes, UCD campus is really beautiful. A lot of green spaces. The lake is really good for mental health, to be honest. Well, especially when you're a little bit stressed about, oh, I'm gonna pass the biostats exam. Is it gonna
Mhm.
be challenging? And you go out with your colleagues and you have a talk near the lake. I think that's
Yeah,
really helpful for mental health. It's really inspiring. So yeah,
great.
I
Great to
enjoy
hear
the
that.
campus.
Great. What advice finally would you give to people who are applying for the course? What would you give them? What advice might you give them?
I think the only advice I would say is be be open for learning, be taking all the opportunities that you're offered. Reach out to your professors. If you find anything challenging, ask questions. Don't hesitate. There is so much out there, and you would never know if you don't ask. I
Yeah.
remember my all the professors saying me, no question is a stupid question,
Yeah.
and that really struck me. I have that learning throughout my course, and it is whenever you are at a hard place, if you're facing any challenge, just reach out. The course is really well designed, and I think it equips you with great knowledge at the end, at least.
Great.
Just to start, so but good.
Great. So the last thing I'll ask you is how has the MPH course impacted the way you look at the world now?
Yes, I would say initially when I joined the course, because coming from a different country, you have a different perspective looking at things, especially if you're coming from a clinical background. But public health opens a lot of different ideas to you. For me, at least I look whenever I'm hearing some changes in the policy. Now, I'm thinking about how it will impact the different audiences, the different uh, populations, how it's gonna create a different view, and that kind of critical thinking, I think you get it when you are applying that in different case. When you're learning it through different cases, when you're exploring different point of views, and I think public health really helps you analyze them. So yeah,
That's great. Thank you very much. And thank you very much for your time today. Much appreciated.
no worries. Thank you
So
so much for having me here.
next slide, Jenny. Thank you very much. So now we're at the question and answer stage, and there are a couple of questions have come in. So Mary, I might let you address these maybe. Uh,
Mhm.
are there any scholarship opportunities for prospective students?
Well, of course, we would love to have scholarship opportunities for all of our incoming students. I guess, understandably, that's not necessarily the case. Having said that, there are selected students who can apply to and might be supported by ICOS, it's the Irish Council for Overseas Students. And we certainly have students each year that are supported by ICOS. I think it's always worth looking at the UCD website to see if there are scholarship opportunities. They tend to be across the board and not specific to our school, but frankly, you never know your luck. We also have periodically people who've been supported, for example, by the Mitchell scholarships from the US, by a particular scholarship from Thailand, and there are some others in specific countries as well that might be available to you. So while we have limited opportunities from within the school, there may be opportunities with agencies with which we are strongly linked. or agencies in your own country.
Thank you. The other question then is, are there internship opportunities? There are two questions on this, but just to bring them together, are there internship opportunities as part of the program, or either locally or abroad? What can we offer there?
Very interesting. We'd love to have internships or placements as part of the program. However, in a one-year program that we do indeed pack pretty tightly, and Sonal gave you an indication there of the workload, especially as it comes towards the end of the different trimesters. And so we run a pretty tight ship in terms of time. We have from time to time attempted to have, let's call them placements with our own faculty, where during summer months they can provide opportunities to analyze data, or indeed to use data that are already analyzed to write some papers, and can even result in either presentations or publications. Let's say they are not fixed from year to year, and they are subject to what might be available. That said, we publicize every opportunity, both from anything that becomes available internally. We have strong links with several of our agencies, both our health services executive agencies like the Health Protection Surveillance Centre. We have colleagues there who sometimes contact us wondering if there are students who may be interested in a short-term placement. Many of our students have also worked with, for example, the Health Information and Quality Authority, with the Health Research Board, and with other agencies of the state. And indeed, we've had some success with students when they finish their program, even before they graduate, being recruited by, for example, EY, Ernst & Young Management Consultancy, where they've been developing their medical specialism and have been really quite interested in taking on students from an MPH program. So anything that comes our way, we upload and advertise to students and say, you heard Sonal saying connectivity, connections are really important. Sometimes even to offer to do something at no pay or reduced pay can lead you to the next opportunity. And this summer, there was an opportunity for 4 or 5 students, along with Sonal, to engage with our One Health Centre, which is a WHO collaborating centre, which has been established within the past year. And they needed to sort of get underway with some activities. And I think that's been really quite successful for the students that participated. So insofar as we can, we identify and profile and publicize to the student group the opportunities that are there. And I should mention, it's not necessarily confined to internal UCD or national. We have links also with ECDC, I mentioned, we have people who've done their EPIET fellowship. We have links with WHO, with ASFR, and we're more than happy to support people who wish to look at opportunities in those places.
Okay, so a couple more questions. What other career areas do students go into? And we have a few more, so we need to move through.
Okay, very quickly then. So career opportunities, this is always challenging. If you think about the agencies I've mentioned, some of those end up being career opportunities for people. We should also say that people with medical qualifications, at least some from here, from perhaps UK, can enter into the training program at the Faculty of Public Health Medicine. Also, there are from time to time, academic opportunities as research assistants. And I should say also in some of our teaching hospitals where faculty have appointments, there are frequently possibilities for research projects or research assistant. So academia, health services,
and also PhD opportunities through SPHERE.
And absolutely, graduate study opportunities aligned to particular supervisors who perhaps have secured grant funding. Yes,
and particularly if you're interested in an academic career in public health.
Yeah, exactly.
So, the program is a September start and end in May. That's the next
Correct.
question.
Yes, that's the teaching program. The dissertation takes people into the early part of July.
Yeah, so September to the first week of July is the program. For most people. Do you know of any scholarships that domestic students have come to the program with?
Not especially, I would have to say, unless they have been able to secure support from an agency they're working with and that's willing to pay
Yeah.
for their fees. Yeah.
And the last question is not a question, but a request to provide links for the entities you've mentioned that offer scholarships for international prospective students.
Oh, for sure. We can put up links to ICOS and whoever else. Yeah.
And I think the European Public Health Association, the EPH program as well
Yes.
might be something to give the link to as well.
Indeed. Yes. Yeah.
Thank you very much. Okay, I think we've come to the end of our time, and it remains for me to thank Mary and Sonal for today, and also to thank Jenny very much for her organisation of today's session, which I hope you found useful. And if you have any other questions, you can always address them, I think, to the program, and I'm sure there'll be a link up for any other questions to be answered. But we've run out of time for our session now, so I think we'll have to leave it at that. Thank you very much for joining us today, and we really do hope to see you in September. Thank you.